I'm Lawrence Gluskin. I'm a gastroenterologist at St. Joseph Hospital in Chicago. I will see all GI and liver conditions. I do see a large amount of patients who typically have irritable bowel syndrome or inflammatory bowel disease. We see a lot of patients who have reflux disease because it's common. And also what I find fascinating is we now have, with the new hepatitis C drugs that we have, we essentially cure most patients. So those are all areas that I have an interest in. Although, again, with gastroenterology, we see patients both with GI conditions and liver and pancreatic disorders. We do surveillance for cancers. We've recognized now over the years that certain patients have risk factors for certain diseases, be it Barrett's esophagus, where they're at risk for cancer of the esophagus, or colon cancer, where they may have had a history of precancerous polyps. So a good portion of our day is being done doing surveillance, where we may do tests, follow up sometimes several years after their initial test, but looking for early changes in the attempt that if somebody was to develop a cancer, it could be caught early or in a precancerous stage. I think it'd be important for patients to know that I think that I look at each patient as unique, and each patient should be approached in a unique way. Every patient has their own problems, their own concerns, their own anxieties, and so I try to individualize each patient in my approach to each patient. On the other hand, I mean, my goal is with everybody to try to help them, to hopefully have them leave satisfied, and in such a way that all their questions are answered, if they're with their family, all their family's questions are answered. And the main thing is to leave them with a sense of satisfaction and to feel satisfied that everything that can be done is being done and in the correct way.